My name is Jordan. I'm a Ward 7 resident, and I'm the proud parent of two girls, ages 1 and 4. When COVID vaccines first became available for my children, I was excited, curious, and also a little nervous, just wondering about introducing a new medication to children who were so young. But just like I did when I was pregnant, considering receiving my own COVID vaccine, I did my own research. I looked at both scientific information, anecdotal information from other moms, who had come before me and shared their experiences. And I felt confident that I was doing the right thing for my kids. I'm proud that they're both now fully vaccinated, and I feel more confident when we're, in larger spaces, when our 4-year-old goes to school and the 1-year-old to daycare. I'm glad they have that extra level of protection.
Hi, I'm Greg, a proud parent of 3 teenage children. When the COVID-19 vaccines became available, at first, I was hesitant. I wanted to see how other children would respond to the vaccination. But after having conversations with my own doctor, as well as our children's pediatrician, I felt better about allowing them to become vaccinated. And also, they advocated to become vaccinated. They were eager to get back to activities that they enjoyed, like sports and playing basketball and hanging out with friends, in addition to family gatherings that we love to do. So overall, I'm proud that they're vaccinated. I think this is our way as a family to help fight against the COVID-19, virus and help us all be as safe as possible.
Hi, my name is Dr. Bodrick, and I'm a pediatrician in Washington, D.C. I'm encouraging you and your family to get vaccinated against COVID-19. The vaccine is a safe and effective way to protect your family from this virus. Getting vaccinated is an important choice, so if you have any questions, please contact your pediatrician or healthcare provider.
Hi, I am Dr. Quarles, and I am a general pediatrician in Southeast DC, and this is my pandemic baby, Miles. I was really excited when the vaccine became available for children under the age of 5. My husband and I didn't hesitate when we made the decision to get Miles vaccinated for COVID-19. It's actually something that I tell the parents in the office when I see them that my son is vaccinated, and I strongly encourage them to get their children vaccinated. So hopefully that's enough to help people to realize that the COVID-19 vaccine is safe for children. So this is my message to you. We want to protect everyone. We want everyone to be safe, and I strongly encourage everyone to get vaccinated for COVID-19. Miles, is there anything that you want to say to everyone? Do you want to tell them bye-bye? No? You going to tell them bye-bye? Bye-bye. Everyone get vaccinated for COVID-19.
Good afternoon, everyone. Welcome to our town hall. It's the first of our town halls where we want to talk about protecting your family, vaccines and immunizations for the fall. Thank you for joining us. We've got a great list of experts from the area to share their expertise with you. We've got representatives from the American Academy of Pediatrics, the DC chapter, DC Health, DC's Office of the State Superintendent, as well as the Health Benefit Exchange. So we hope you enjoyed today's program. Just a little reminder, we will take questions throughout the program. The best way to offer those questions up are to put them in the chat. We will be monitoring the chat so that we can organize the questions and direct them to our experts towards the end. So please feel free to stick your questions into the chat and we will get to them. With that, I'm going to turn it over to our first speaker. I want to introduce you all to Dr. Asad Bandali. Dr. Bandali is a pediatrician and a public health professional working to ensure access to high quality person-centered health care for all people in the District of Columbia. He uses his training in research, advocacy, and clinical medicine to drive evidence-based changes to improve the healthcare system and address underlying social determinants of health. So we look forward to learning more from the doctor on his perspective about vaccines and immunizations in the district. So with that, doctor, please.
So thank you. And thank you for having me, for the opportunity to speak with everyone today. Hopefully, hopefully I'm able to share some information that's meaningful to you, some perspectives that are meaningful to you. And, I'm happy to answer any questions that you might have today as well when we get to the question and answer portion. So you may have seen these ads around on bus benches and maybe online and stuff. Now is certainly a really great time to get back on track for vaccines, whether that's just catching up on what you might be due for this year, or if you were missing any vaccines or your children were missing any vaccines. I'm going to talk just briefly about vaccine mandates because I'm sure front of mind for a lot of people is the notion of school attendance and vaccines, especially, we've got our representatives from OSSI speaking later today, but you'll hear a bit more about kind of school exclusions and being vaccinated to be able to attend school. But just this notion of vaccine mandates for children in schools has been around since the 19th century. It's been around for ages now. And really it serves three really key purposes. One is protecting children from infection with vaccine preventable diseases, lessening the severity in case somebody does get infected or there is an outbreak. And then, reducing that likelihood of disease outbreaks in schools. You can imagine there are some kids who can't be immunized for whatever reason, whether because of their health or other reasons, medical reasons. And so really important to have kind of that protection that we build around each other. And so for most of our vaccines, the goal may be even as high as 95% or above, where you need to have that many people immunized to really prevent major outbreaks. This right here is, and when I'm looking at it now, it may be actually difficult to piece out, but essentially it's the vaccines that are required to attend school in the District of Columbia. And this matches up with the schedule from ACIP. You may have heard that acronym. It's basically the committee from the Centers for Disease Control that kind of lays out what are all the immunizations for childhood and what's the schedule that's kind of most optimal and where do we recommend which vaccines should your child have. And so you'll notice that for kids that are entering preschool or Head Start, that there are some immunizations needed. When you enter kindergarten, you certainly need to kind of get boosters on your chickenpox and your measles vaccine, your whooping cough and your tetanus and your polio. And then certainly as we head into middle school and the teenage years, we've got meningitis vaccine, HPV vaccine, and your booster on your tetanus again. And then many of you probably are aware, and certainly there's a callback to it in the videos, but the notion of the COVID vaccine. For this year, basically children 12 and up are required to have that vaccine for school. And it's essentially any vaccine that is fully FDA authorized. So some of them were emergency authorization, kind of in the context of the pandemic. But for 12 and up, it is fully authorized. It's been around, millions and millions, tens of millions of kids have had it. We've had a chance to kind of see that these vaccines are safe and effective. And so those are a really great way to protect your kids against COVID. I was asked to share a little bit of data. Hopefully this is meaningful to you. This is compliance. So compliance is, do you have the vaccine or not? But also, is there some reason, like maybe you have a medical exemption or a reason that you can't get the vaccine? And so what we see here is across the district, in wards 4, 5, 7, and 8, those are probably our areas where the highest number of kids who, at least according to our records, are missing vaccines. So this gets built based on the registry, the immunization registry. Some of y'all may be familiar with the acronym for that, DOSIS. Maybe you've used it for your COVID shots to be able to travel or document it for school or something like that. But anyway, basically, the data that's in there is incomplete. You might have gotten shots in Maryland or Virginia, or your kid did. Maybe you have shots because you moved from a different state altogether. Not all of that is in here. And so these numbers may be an overestimate of how many kids are behind on vaccines, but certainly the more data that you're able to share with your healthcare provider or with your school, that's really helpful for us to be able to kind of keep a tab on, how many kids are protected against various childhood illnesses. When we look at this is actually a grade level breakdown, and you can see that there are a lot of kids in pre-K and kindergarten who are behind on shots. That's usually your measles, mumps, rubella, your varicella, your chickenpox booster, and kind of those school entry vaccines. And then again, as we get into middle school and high school, it's those kind of 11 and 12-year-old teenage vaccines that we all kind of need to catch up on: tetanus, meningitis to prevent brain infections, and HPV to prevent cancer. It's the one vaccine we have that prevents cancer, which is incredible. Here we go. Just sharing a little bit of data on COVID-19 rates overall. So this would be kids, the note at the bottom says 5 years and up. This is actually 12 and up. Apologies for that. But basically about 55% of kids, 54% of kids are up to date, have had their primary series, which leaves a pretty big gap of kids who aren't protected against COVID. And we know that this vaccine lessens severity, keeps people out of the hospital, and if nothing else, helps to avoid those missed school days. Speaking as a parent of 2 young kids who missed a bunch of work last week and they missed school because we were isolating for potential COVID, it's a huge hang up for me. And I'm sure for many of you as well. So it's a really great way to kind of keep your kids safe, but also help to keep them in school. Anyway, I'm going to kind of move quickly here because I don't want to take away from other people's time. We've been doing a whole lot of promotion. Hopefully you've been hearing from us, whether that's through robocalls, live calls, mailings, seeing our bus bench ads, what have you. But we've been kind of sending out personalized letters, many things of the sort. Maybe you've seen some of our ads out there. But really kind of the big message is now is the time to get immunized. We've been working with providers here in the district, with DCAAP, with the American Academy of Family Practitioners as well. And then we've been reaching out through the Faith in Vaccine Initiative. We've been working with the Black Coalition Against COVID-19, with ANC commissioners to really just kind of get the message out there and to get information in your hands about the safety of these vaccines, the effectiveness of them, both routine vaccines, your day-to-day ones, and your COVID vaccines. My last bit here, where can your child get immunized? Best place is your primary care provider, whether that's your pediatrician, family doctor, nurse practitioner. They know your child best. They can answer your questions best, speak to your needs best. That being said, if you can't get an appointment to your childcare provider, with your primary care provider, pedsvax.dc.gov, it's on the bottom here, best spot to find this calendar of all the various touch points in the city where we've kind of layered on extra access for vaccines. There's some Saturday stuff this weekend. There's vaccine only visits at Children's throughout these weeks. And then next week, there will be at Children's and at the Ward 7 COVID Center, along with Safeway, in partnership with Safeway, there's going to be kind of mass vaccination opportunities. Best way to schedule that, use the link here. There's a QR code. I'll leave it up there so people can use it. Or if it's at Children's, just give them a call. If it's at Mary Center or Unity, give them a call, or your primary care provider. Schedule ahead. Don't wait. Don't do walk-in. You're going to be stuck in line. We'll certainly have the ability to schedule on site as well, but just schedule ahead. If you have an appointment, you'll be able to show that to your school to say, hey, my kid has an appointment, couldn't get vaccinated today, but is going to get vaccinated in the next couple of weeks. They'll be able to get back in school. So yeah, schedule. But certainly if you need to walk in, we can certainly work with you on that. Anyway, that's my spiel. I really hope that was useful information for you. I'm going to turn it over to our next illustrious speaker.
Thank you, Doctor. Let me introduce our next doctor, another great pediatrician, Dr. Jatoya Mangat. She's a board certified family practitioner, nurse practitioner who's worked in primary care in the Southwest DC area for the last 8 years. She's a board member of our DC chapter of the American Academy of Pediatrics and also serves as a co-chair on the chapter's school health committee. So thank you, Doctor, for joining us and sharing the latest information you have on understanding vaccine hesitancy and some other work the chapter's been doing.
Wonderful. Good afternoon, everyone. So I am going to be speaking mainly on the COVID-19 vaccine series for children, and then going into some of the work that our chapter, the DC chapter of American Academy of Pediatrics, has done to help in communities in DC. So to start, I just kind of want to go through the vaccine series for peds. So peds and young adults, again, I know that it's a lot of information, it's ever changing. The best source for information is your primary care provider again. However, if you go to any of those vaccine clinics previously highlighted by Dr. Bedley, they will also have the most up-to-date information on what doses you need. Those clinics, in addition to COVID-19, can just do any of the general childhood immunizations, which we also encourage and want everyone to be up to date on. So again, by no means do you have to memorize every single one of these, just kind of know where your child falls and then the next dose that they should get. So starting with the 6 month to 4 years children, which is the newest group, the youngest group that's able to now be vaccinated, they have 2 brands available for them. So there's the Pfizer and the Moderna. So for Pfizer, for this age group, it is a 3-dose primary series. So the primary series is that initial series that we're giving to children and adults just to kind of get you to a threshold level of immunity. And then after that, you'll also hear the term booster, which over time, immunity wanes naturally. So the booster doses is what kind of like pulls you back up to that threshold level. So for the primary series for Pfizer, for the 6 months to 4-year-olds, it's a 3-dose series. The first dose is given, and then the second dose is a minimum of 3 weeks after that. The third dose is a minimum of 8 weeks after the second. I should say the ranges that I've put on these slides are those that are recommended by the CDC. There is a minimum range to get the next dose. Sometimes people go a little bit outside of that tail end of the window, and that's okay. You don't ever have to restart the full series. There are a few exclusions. You should speak with your own healthcare provider again if you feel like for some reason you should wait much longer than the recommended window, but minimum 3 weeks, maximum-ish of 8 weeks. And then third dose 8 weeks after the second dose for Pfizer. For Moderna, for this age group, it is a 2-dose series. So you get the first dose and then the second dose, a minimum of 3 weeks. Again, this information is ever changing, but as of right now, that this age group does not require a booster dosage of any kind. The next age group, the 5 to 11-year-olds, also have the Pfizer and the Moderna available. Only difference, Pfizer is a 2-dose series for everyone 5 and up. So you get your first dose and then the second dose a minimum of 3 weeks later. And that's everyone 5 and above. And then for this age group, the Moderna is 2 doses. Also, second dose is a minimum of 4 weeks after that first dose. For this age group, a booster dosage is recommended. However, for this age group, they are getting the original Pfizer booster, which is the monovalent booster, which just means that it has most coverage against that initial COVID-19 vaccine strain that was circulating, the Delta variant, and that's the monovalent booster. So again, always go to your healthcare provider with questions and further recommendations. This might be changing in the coming months, but for 5 to 11-year-olds, regardless of which primary series you received, the booster will be a Pfizer booster 5 months after your second dosage, and that's the older Pfizer booster, the monovalent. Next, the 12 to 17-year-olds have 3 manufacturers available for them. So the Pfizer and Moderna, which is the same schedule as previously discussed. And then the newest one is the Novavax, which may be available at some places throughout DC. We as the Academy don't give recommendations necessarily for which brand is better than the other. You really should just take whichever brand is available at the site that you're going to, because they are all effective. They've all had testing. But this Novavax one is also a 2-dose primary series. The second dose is given a minimum of 3 weeks after the first dose. For the 12 to 17-year-olds, they should receive a booster dosage, and they should receive the bivalent booster, which is the newest booster available from Pfizer. For this age group, they actually can only receive the Pfizer booster. We'll talk about the 18 plus, which also has the Moderna booster available, but this bivalent booster is going to have the best coverage against the currently circulating Omicron variant. That booster should be given 2 months after the primary series, or because some of these children have had their primary series in a booster already, they should still receive the bivalent booster, but 2 months after their last booster. For our young adults and all the way up through adulthood, 18 plus, you have the same 3 manufacturers available, and then also the single dose Johnson & Johnson, which again might be available throughout the district at some places. The schedule is the same as previously discussed for the 12 to 17-year-olds. The only difference is that for 18 and plus, there is a bivalent Moderna booster that is also available. So everyone 18 and up should be receiving a booster with the new bivalent, either Pfizer or Moderna, and that's 2 months after your primary series or after your last booster dose. And again, specifics can be discussed on an individual level with your healthcare provider. There are some common questions that we often get regarding the COVID-19 vaccine. One of the most common ones is that, like, oh, I've had COVID, do I still need the vaccine? And the majority of the population now has had some variation of COVID at some time throughout the pandemic. We still want you to be protected with the vaccine. So immunity from actually having COVID-19 you do have a few months of immunity. So you can wait a few months before getting the vaccine. But after that, in order to extend your immunity, just like we want for anyone that's not had COVID, we do want you to still have the vaccine. The only consideration is that if you recently had COVID-19, we don't want you to be past that 5-day isolation, and you should be free of symptoms. Similarly, if you've had COVID-19 and you actually receive an antibody or plasma infusion while sick, you should still also extend your immunity that we know you had from the actual disease plus the antibodies with the vaccine. So we still want you to get the vaccine. Again, you can wait a few months because you do have some natural immunity, but that is not lifelong or as long as the vaccines may provide. So after 2 or 3 months, you should still get the vaccine. And then for the small percentage of the population that might have had COVID-19 and also had a multi-system inflammatory syndrome, whether it be as a child or as an adult, you should also get the vaccine, but you must wait at least 3 months before getting the vaccine series and or boosters. So next I'm going to show some graphics that came from coronavirus.dc.gov, which I frequently go to as a healthcare provider and public health professional, just to kind of look at the data. It's a really nice, robust system that slices and dices the data throughout the District of Columbia different ways. So for our chapter, we received a grant earlier this year to look at COVID-19 vaccine uptake in communities. So we initially went to coronavirus.dc.gov and looked at just kind of where the disparities were. Initially looked across age groups, and these weren't the graphics that we saw initially. These are current as of the end of last month. So looking across age groups with DC residents, for the pediatric population, which is where we are focusing, the 0 to 4-year-olds, because again, they are the newest group to be able to receive the vaccine. Coverage with the primary series is only at 15%. Our 5 to 11-year-olds were at about 45%. And then the 12 to 17-year-olds are doing better. It was available to them longer. Plus, they have these school mandates that we're very proud of, and we'll discuss a little bit more with Ozzy after my portion. But they're at 75 to 79%. Our young adults, we have some work to do, the 18 to 24-year-olds who often feel like invincible or like that they're not going to get that sick. So we still want to work on coverage for that age group. We also looked at this data across race, and we saw, again, the disparities in the African-American or Black community, where the percentage of coverage for COVID-19 vaccine completion primary series was lower than that of white or the Asian Pacificers in the database. We then decided to focus in on specific areas that we could try to speak with parents and increase compliance. Again, this graphic is as of the end of last month, but we still see that wards 7 and 8 are lower than the rest of them. However, now wards 1 and 2 also are starting to lag behind the other half of the city in their coverage rates. But when we first looked at this earlier in this year, wards 7 and 8 was where there was the lowest percentages. So that's where we kind of focused our efforts for this cycle of the grant. So we went into the communities, tried to advertise, and really wanted to speak with parents and caregivers about their barriers to receiving the vaccine. However, we also spoke with parents and caregivers who had their children had received the vaccine to also see what influenced them. And from those that were unvaccinated, the most common concerns are those that we hear in the general population, which is the safety and effectiveness, the length of time that the vaccine had been available and developed, and then the side effects. So again, safety and effectiveness, we've now given out millions of doses, even just to children. So we know that it is safe. If for some reason you feel that your child had a reaction to a prior dose of the vaccine, you should speak with your healthcare provider immediately afterwards. But if you didn't do so for various reasons, you can still discuss that with them. If it was found to be a true reaction, there is a national database where these reactions are documented. But again, it's a very, very low percentage of people that are actually having reactions. So it's very safe, very effective. We are continuing to study like the length of time that it helps provide immunity for, but we know that it's for at least this 5 to 6 month period that we're giving the primary series before the booster dosages. And then side effects, I always discuss with patients just kind of expected side effects, common reactions right afterwards. So just with any vaccine, there might be a little bit of pain at the injection site, a little bit of soreness. I tell people to move their arm around. You can do warm cloths, you can do cool cloths. Might have a little bit, some people do get a fever afterwards. Tylenol and ibuprofen generally can be used to manage these side effects. Same for like body aches. I always talk about hydration and rest if you're experiencing that. But for our pediatric population, it's been really, really well tolerated. I know us as adults sometimes like to complain about things, but it's generally not hearing a lot of that in the children that have been given the vaccine to. And again, any side effects that have developed have usually been able to be cured with just a little dose of a pain medication. And speaking with those about what's the most influential for them, conversations with primary care providers, social media, and then conversations with friends and family is what was highlighted. So again, speaking with your healthcare provider is going to be your number one source. Even if you're hearing things or seeing things, unless it's from a reputable source on social media, you can always go back and verify that with your PCP. Friends and family, same things. Everyone has a story. Sometimes they spread those stories. I say that if you want to, verify the information that you may hear from others, you can again speak with your PCP. But for these reasons, we kind of marketed community caregivers, and then had them record videos. Some of those you saw at the beginning for those that were here at the beginning of this town hall. We also posted flyers and these videos on our social media campaign. So again, a reputable source, the DC chapter of American Academy of Pediatrics on Facebook and Instagram. We're planning to still post posters and flyers with familiar faces from the community in these boards. We've asked some of the parents, those that did the videos, to become champions and kind of advocate in their community, and then are always encouraging primary care providers to speak with their patients about it, because we do know that one-to-one conversation is one of the most effective ways. I did want to highlight just two of the videos from the parents, our parent champions. There are other parent videos on our website and other primary care provider videos on our website, including yours truly. So you guys, the link will be after these videos. Luke will show the link because you are welcome to go to that website to listen into all the videos. And once the flyers and posters are available, they'll be downloadable from there also.
Hi, my name is Jordan. I'm a Ward 7 resident, and I'm the proud parent of two girls, ages 1 and 4. When COVID vaccines first became available for my children, I was excited, curious, and also a little nervous, just wondering about introducing a new medication to children who were so young. But just like I did when I was pregnant, considering receiving my own COVID vaccine, I did my own research. I looked at both scientific information, anecdotal information from other moms, who had come before me and shared their experiences. And I felt confident that I was doing the right thing for my kids. I'm proud that they're both now fully vaccinated. And I feel more confident when we're, in larger spaces, when our 4-year-old goes to school and the 1-year-old to daycare. I'm glad they have that extra level of protection.
Hi, I'm Greg, a proud parent of 3 teenage children. When the COVID-19 vaccines became available, at first, I was hesitant. I wanted to see how other children would respond to the vaccination. But after having conversations with my own doctor, as well as our children's pediatrician, I felt better about allowing them to become vaccinated. And also, they advocated to become vaccinated. They were eager to get back to activities that they enjoyed, like sports and playing basketball and hanging out with friends, in addition to family gatherings that we love to do. So overall, I'm proud that they're vaccinated. I think this is our way as a family to help fight against the COVID-19, virus and help us all be as safe as possible.
So again, the parents that we spoke with really highlighted wanting to hear these real stories from other parents and healthcare providers. All of those are available on this website to see more videos. So I will turn it over to our next speaker.
Thank you, Dr. Mangat. Our next speaker is David Esquith. He is with the DC Office of the State Superintendent of Education. For the past 3 years, David has served as Director of Policy Planning and Strategic Initiatives in the Health and Wellness Division of DC OSSI. Prior to that, David served in multiple positions at the U.S. Department of Education, where he most recently was a director of the Office of Safe and Healthy Students. And this is my favorite part of his bio. He is a father of twin 16-year-old girls, and if anyone has any advice about how to survive the next 2 years, he would like to speak with them afterwards. Thank you, David, for being a part of our program today, and we look forward to hearing more about the attendance policy and other words of advice. Thank you.
Well, thanks, Keith, and good afternoon, everyone. It really is my pleasure to be here representing the Office of the State Superintendent of Education, and I send you greetings from our Superintendent, Dr. Christina Grant. And we can go on to the next slide. What I'm going to talk about is something called No Shots, No School, which is the district's immunization attendance policy that applies to all of our students through K through 12, and that all parents should be aware of if they have a student in the education sector in the district. So a little bit of our legal background. In 1979, the district passed a law called the Immunization of School Students Act, What it did was establish standards for immunizing district students against preventable childhood diseases. So these are your routine pediatric immunizations that our colleagues on this call have already identified for you and shared information. What the Immunization of School Students Act of 1979 said was that schools are not permitted to allow a student to attend more than 20 school days if the school does not have a certification of immunization or a medical or religious exemption. So this is key, that since 1979, schools have not been permitted to allow a student to attend for more than 20 school days if these students essentially are not up to date on their immunizations or they have a medical or religious exemption. The regulations that were passed in association with this act said that OSSE, the Office of the State Superintendent of Education, in coordination with district public schools, the district public charter schools, and the Department of Health, are required to enforce these immunization responsibilities in order to allow for school admission. In 2021, the district also passed a Coronavirus Immunization of School Students and Early Childhood Amendment Act. And what this says is that students who are of an age for which the COVID-19 vaccination is fully approved to receive the COVID-19 vaccination, currently that is ages 12 and older, beginning in the 2022-23 school year. So taken all together, what the information that I provided so far says that for this school year, starting in September, schools are enforcing the immunization attendance policy, which is requiring all students to be up to date on their routine pediatric immunizations and the COVID-19 vaccination if they're currently 12 or older. And if the students are not up to date, then school must notify them and give them 20 days to come up to date. If the school does not receive that immunization certificate, after the 20 days, students are not allowed to attend school. So I'm going to go into kind of the process in our next slide, the process that schools have been using and are using right now. This is kind of 6 steps for a school to take before enforcement. And there's a couple of things I'd like to point out before I go into these 6 steps. That is that everyone involved in this process, the Department of Health, OSSE, DCPS, the charter schools, see not allowing students to attend school as a last resort. DC Health and OSSE and different schools have been making vaccines accessible to students since the end of the last school year. Our office alone made over 4,000 calls to parents identifying the vaccines that students may have been missing and needed to take to be up to date. And DC Health has done the same thing. So there's been an incredible amount of outreach done already that continues to this day to notify parents as well as to make sure that the vaccines are accessible to everyone. So here are the steps that schools have been taking in regard to no shots, no school. Number 1, they established a school health team. Number 2, and this is critically important, they have been disseminating information to families on a regular basis. Since the end of the last school year, on a weekly basis, information has been going out to families on multiple media to let them know about what is required. and on an individual basis to families to let them know if their child is missing any particular vaccines, and most importantly, where they can go to get those vaccines. Schools are conducting frequent reviews. They have information to immunization records of students. They are continuously on a daily basis checking those records to make sure that students are not are up to date. And then if a student is not up to date, they move on to step 4, which is to send notices out to parents to let them know that, number 1, here are the vaccines that your student still needs to get in order to be up to date. And number 2, here's where you can get those vaccines as soon as possible. And that if after 20 days, the student is still not up to date, unless they have a medical or a religious exemption, that they will not be allowed to attend school. And so that is step 5, is to go through kind of the various steps that I've talked about up to this point. And then after that 20 school day has passed, students are not allowed to come to school. Finally, in step 6, once a student does come up to date on their routine pediatric immunizations, the unexcused absence that they were identified within their attendance code is converted to an excused absence, and the student is allowed back in school. So again, want to reinforce that it is everyone's intention, making their best efforts to avoid students not being allowed to attend school, and that this is being done only as a last resort. In recognition of kind of both the impact and the need for all students to be in school as much as possible. Next slide, please. So here's kind of a timeline that the DCPS put in place for this year. And I'm not going to go through all of the details in this, but essentially what DCPS did, and many charters have done as well, is they've kind of broken kind of the cohorts into 2 groups. That original notifications were sent out to DCPS students in grades pre-K through grade 5 on September 7th, and then 20 school days after that was October 11th, which is coming up next week. So that we had students and families who were notified, who were DCPS students, and some charters also use this timetable in pre-K through 5, telling them that their deadline for getting in their immunization certification records was October 11th. That same 20-day notice process is being applied to grades 6 through 12, starting on October 3rd with a deadline of November 4th. So middle school and high school students were put into a second group of a second cohort of students who received their first notice on October 3rd with a deadline of November 4th. And then kind of a third category was the COVID-19 vaccination for students age 12 and older. They will be notified on November 21st and have until January 3rd to come up to date. So that's the process for our 3 cohorts, pre-K through 5, grade 6 through 12, and then for students age 12 and older, a separate timetable for the COVID-19 vaccination. Next slide, please. Here is an example of the immunization attendance policy materials to support schools. These have been on OSSI's website for at least 2 years. You have the policy, you have frequently asked questions, you have a description of the process, And we've tried to make this, and all of these materials are available in languages other than English, and make all of the policy and the resources available to everyone on a for a significant period of time. Next slide, please. More examples of the resources that we have provided to schools, and schools are sharing with families. We have a frequently asked questions document for families, a frequently asked questions document for schools, template notification letters, and lists of immunization locations to send home to families. It has been really a district-wide effort to get information to families and to make vaccines available and accessible to them. Next slide. So if you have any questions regarding the policy, we are happy, my office is happy to answer them. On the screen, you see our email address. It is asi.healthandsafety@dc.gov. And I believe those are all my slides. Happy to turn it back to you, Keith.
Thank you. All right, our last presenter today is Purvi Kemp. Purvi she serves as General Counsel and Chief Policy Advisor for the DC Health Benefit Exchange, and has since 2014, after joining the agency as Deputy General Counsel in 2013. Having been with the exchange since its early years, she filled various policy, management, and operational roles, including establishing the inaugural Assister Program and Broker Advisory Committee, staffing numerous exchange policy working groups, and managing development and implementation of policy. So, Ms. Kemp, would you like to talk to us about open enrollment and health benefits and what people should know?
All right, can you all hear me now? Excellent, great. Thank you for the introduction. Actually, I'm just gonna make a correction there. My name is Purvi Kemp, but I am the Deputy Executive Director of the DC Health Benefit Exchange Authority. I appreciate you all having me here today to help with this conversation that's so important. And what we're going to talk about is really your health security, your financial security, how you can get these vaccines, and how health insurance plays a very important role in that. So the DC Health Benefit Exchange Authority, we are a public-private partnership responsible for DC Health Link. And hopefully you've heard of DC Health Link. That is the district's Affordable Care Act, or Obamacare health insurance marketplace. So I will, if you haven't, I will make sure you know who we are by the end of this presentation. So we, DC Health Link is an ACA state-based online health insurance marketplace. We opened up with all of the others, including healthcare.gov, on October 1st, 2014. And we're one of 4 that opened on time and remained open ever since. And we're very proud of the fact that we've been serving DC residents and small businesses. We cover 100,000 people through this private health insurance. And since the Affordable Care Act, we've helped cut the uninsured rate in half in DC. That's a really big deal. Near universal health coverage, with more than 96% of DC residents having health insurance coverage. And we rank number 2 in the entire country for having the lowest uninsured rate. Right now, we have 157 plans available by 4 health insurance carriers in our small business marketplace, and 25 individual and family plans in the individual and family marketplace for this year, which is 2022. These options are available to everyone, really allowing you to choose between 4 carriers: United Healthcare, Aetna, CareFirst, Blue Cross Blue Shield, and Kaiser Permanente, for small businesses and their employees that are here, businesses that are here and their employees that are anywhere across the country. And we have the CareFirst, Blue Cross Blue Shield, and Kaiser Permanente in the individual and family marketplace. One of the things I really want to highlight is, why is healthcare so important? Well, we know it's not just your health security, but it is your financial security. It is the number one reason people used to go into bankruptcy, is not having health insurance before the Affordable Care Act came into place. Those are the days where, there were pre-existing condition exclusions. They charged you more if you were a woman over being a man. So now we have access to affordable health insurance. But once you have that health insurance, is it still affordable? Can you get coverage? So how can you get that coverage? We know there's deductibles. We know there's copays. And what I'm here to talk to you about is to let you know, in these plans, both in the individual marketplace and starting shortly in the small business marketplace, we have standard plans that have no deductibles and allow you to really access primary care providers and specialists, urgent care and generic drugs without hitting your deductible. There will still be copays, but you don't need to worry about the big deductible. So if you're worried, do I have the flu? Do I have COVID? Do I have anything else? And I want to go see my doctor, I can just pay the copay and not worry. We also have, for these standard plans, we have insulin covered at zero cost sharing this year. And a step further, starting January 1 of next year, type 2 diabetes is going to be covered at zero cost sharing to patients with no deductibles, no co-insurance, no copays, not for the physician visits, not for the lab work, not for the eye exam or the podiatrist, not for the insulin and other prescription drugs. That's a really important step we're taking to help on health disparities and really hit at a condition we know has a disproportionate impact in the Black and Brown communities. And really specifically for this conversation, I want you to know there is free preventive care. Free preventive care for all the vaccinations that you have heard of. That is true. You can get them as part of your well baby and well child visits, which are also free. That includes all sorts of screenings, including mental health screenings, vision screenings, alcohol, drug misuse screenings and counseling, tobacco intervention and counseling. You can also get, and this is not just kids, adults, you can get birth control, cancer screenings, diet counseling, screening for numerous chronic care conditions, and much, much more. All of that, once you have your health insurance, it's free, meaning it is truly, it is something that you don't pay a deductible for, you don't have to pay copay or co-insurance. Going too fast. Okay, so this is really important to let you know. So the Inflation Reduction Act, this law that just passed, President Biden signed it into law after Congress passed it. It lowered health insurance premiums for DC residents through 2025. That's more than $36 million that's now available in relief to DC residents in premium savings when you actually go to buy that health insurance. So if you're a DC resident in the individual and family marketplace where you buy your own insurance, you're not getting it through your employer, you will not pay more than 8.5% of your income for premiums. Previously you could have paid so much more because it really, premium prices keep going up. We know that. And this is a protection that was extended to keep that affordability in place both because as the COVID relief law did, they extended these protections to make sure you could not only afford that health security, but again, the financial security that comes with it. So no one pays more than 8.5% of your income for premiums. It is upfront. Once you come to dchealthlink.com, your premiums will be lowered for whichever plan you choose. And the most important thing to know is now is the time. Right around the corner, November 1st to January 31st is open enrollment. Open enrollment is here. If you do not have health insurance coverage, you can go in and starting on October 17th, you can start looking at plans for next year, for 2023. You can think about what you want to enroll in, and you can sign up for January 1 coverage. You can also just not wait because there are special enrollment periods. If you have a change in life circumstance and or even because of COVID, you can get in right now and get insured for next month. If you find that you're eligible for Medicaid, that's district's free health insurance program. You can get that at any time. So it is really important that you know now is the time. If you find anyone who is not covered, those few percentage that are still not covered, make sure they make their way to dchealthlink.com. Small employers can sign up for health insurance for their employees any time of the year. So if you are looking to be competitive, to attract staff, to make sure they're healthy to come to work, to make sure their kids are taken care of, now is the time. And every month of this year, every year, you can sign up anytime to offer health insurance to your employees. You can offer it to their kids, and no matter where those employees are across the country. So again, if you enroll by December 15th, you'll get coverage that begins January 1st. And then it'll go all the way through if you enroll at the very end by January 31st. Coverage will begin on March 1st. So this is very important. Make sure you know that people do not have to wait. Again, there may be qualifying events that get you in earlier. And here is how you find out more information. dchealthlink.com. That's where you go. That's where you can look for assistance. You can find an in-person assister to actually work with you if you want help. You can call our contact center and apply over the phone. You can go on our website and in less than 60 seconds find out if you could be eligible for those lower premiums under the Inflation Reduction Act. Go ahead and take that 60 seconds and find out if you're eligible for those lower premiums. So that is it for me. Thank you so much. And I will turn it back over to Keith.
All right, thank you. Well, we do have a number of questions. I'm going to start with one point somebody reinforced from our first presentation, and Dr. Ben Daly had to sign off early, so he will not be able to help answer questions from DC Health, but the others, I hope you can stay on and help answer a few of these. One point was made about pedsvax.dc.gov is a great resource to go to when you're looking for information on where you can get vaccinations or find information. So that's peds, P-E-D-S, vax.dc.gov. So that's been on some of the slides here. And then I think we'll just jump into some of the questions, and I'll try to point them to those I think have the best perspective, but of course, feel free to jump in on these. The first question is about mask wearing in children. There's been a lot in the news about, changes in requirements about which settings to wear a mask in. What's the latest recommendation for parents and children about wearing masks in public spaces or in school? So maybe Dr. Mangat, can you talk about it, what you're advising or what you think for your children, your neighbors' kids?
Yeah, so I mean, of course, we always want to follow the local mandates, which are based on community trends. So as trends in DC and Maryland, as COVID rates are going up, the mask mandate at some point this fall, winter might be reinstated. So of course we want to follow that. But I always tell people to err on the side of caution. even for my kids, we're in these like parent chats. So once someone tells me that I've seen a couple of like COVID positive cases, so I have asked my children to start wearing their mask again. The thing is, in the beginning, we were so concerned about like, oh, kids in the mask and like, can they breathe? But they're all so used to it now. It's been like 2 years. So it's really not a burden on them. I just tell people to err on the side of caution. And again, that's my personal practice for my family as well. And then always, again, filter back to your primary care physician, but follow local mandates for sure.
David, would you like to jump in? Anything to add from the Aussie perspective?
No, I think that's absolutely on target.
Okay. There was a question in there. Does AAP have a hotline for questions about COVID vaccines?
Yeah, so I don't see a national hotline from American Academy of Pediatrics. I saw that one in the chat. I know we definitely don't have a local hotline, but CDC does have their hotline in which they say you can go to for COVID-19 questions. But again, if you have specific questions, your primary care provider is really going to be the best person to give you that personal advice, and they know your child and the history, or they can look it up if they don't know it, and you can really get the most helpful information from them.
Great. When should kids under 1 year old get vaccinated if they've had COVID? Do they wait the 90 days or whatever they tell adults to wait, not to rush out and get a vaccine?
Yeah, they can, just because we know you have some natural immunity. So the recommendation is that you can wait 2 to 3 months, the 90 days, but you kind of have to weigh it on your personal family thing. Some people like to group all their children's vaccines together, so you can get it sooner than that. The only time that we ask that you don't get it is if you're under that isolation period or you have symptoms.
Got it. It's been in the news also that some newborns are being born with antibodies if the mother had COVID. Does that affect their timeline for when kids should be vaccinated?
No, and currently the youngest you can be vaccinated is 6 months. Again, we know with some antibodies, you can have some months of protection, but by the time they reach that 6-month mark, they are still eligible for vaccination.
And Purvi, you kind of touched on this one. What about somebody without insurance? You talk about how it's built into health plans, but what else should they know?
Yeah, I mean, it's just know that for vaccinations, you can get those for free. DC has made it available at numerous locations. That PedsVax, that website, that's where you go to find it. What we really want you to know, though, is just getting the vaccines is not the health and financial security you're looking for. And there is health coverage for you, depending on your situation. If you really can't afford it and your income doesn't allow it, there is free coverage available in DC. And there is lower premium coverage available in DC. We want you to have that protection. We want you to be able to take yourself or your kids to the doctor when they need it. And we want you to get all the preventive benefits, not just the vaccines, but everything else, to catch something early and be able to take care of it and feel and really be on top of your health and maintain that security, so you don't end up in a situation where then you need care and you don't have coverage. So make sure that you really know you can get the vaccines right now, today, for free, with or without coverage. But there is so many more benefits to being covered.
Thank you. A question about the attendance policy, and this is kind of a long one, so I'll have to kind of chunk it up as best I can among you all. Let's talk about the efficacy and, why it's required for kids to attend school. If there's some debate about it, how effective the vaccines are, how would you answer that, Dr. Mangat, about the effectiveness of the vaccines and why someone should be, more in favor of getting and being more compliant, with the requirements of schools?
Yeah, so I'll talk about the effectiveness, and then we'll ask maybe David to comment on some of the Aussie background and how the school decision was made, which I'm still in full support of. And do think that we are kind of one of the leaders in that, and it has gotten our vaccine rates. But, you know, we know that the vaccine is not 100% effective, but we also know that it does reduce your chances, particularly once you become of age to get the bivalent with the latest circulating Omicron strand coverage. We also know that for any child or adult, it reduces, even if you get ill, it reduces your chance of that severe illness and morbidity and death, which is also what we're, as carers of people, public health professionals, that's what we're also trying to prevent. So although not 100% effective, it does definitely have some benefits, and it's proven to be safe. So, Mr. Esworth, do you have anything to add on the OSCE side?
Yeah, on the OSCE side, thank you. On the OSCE side, I would just point out, as we said on our slide, that this is a legal requirement. This is something that was passed by the council, and making it part of the menu of vaccinations that children needed to have in order to be in compliance with the Immunization Requirements Act.
Another part of this question is talking about, you know, expelling kids, essentially putting them out of school. What will they do while they're out of school? You know, what are other districts seeing that have implemented this? Are they having, you know, the same challenges with the community or pushback? What are some of the concerns, and, you know, how are others addressing this or prepared to address this?
Yeah. Well, thank you, Keith, and thank you for this question. One thing I would like to clarify in regard to the wording of this question is no one is being expelled from school. What the immunization attendance policy says is that, you know, until students have submitted their immunization certification, they are not allowed to attend. But no one is being expelled. As soon as that information is in the hands of the school, students will be attending school. So no one's being expelled. I would point out, and this is really an important consideration here, the District of Columbia is last in the country in terms of the compliance rate on routine pediatric immunizations. We are absolutely last of all of the states. So that is part of, and an important part of, the motivation to implement a policy that has been on the books since 1979. This particular legal requirement has not been enforced up to this point for different reasons, in regard to kind of the fact that we are last, that we have an immunization rate that is significantly lower than every other state is part of the motivation for doing this, and that every other school district in the country implements this policy and does it with fidelity, so that all of our surrounding school districts, Prince George's County, Arlington, Fairfax, every one of them, Montgomery County, they implement this policy and they do it with fidelity. And what happens is that once it is implemented with fidelity and people recognize that the policy will be implemented as written, then parents and families make sure that they are up to date on the routine pediatric vaccinations. In regard to the issue of kind of the impact on the community, there's no evidence. We have no evidence from other jurisdictions that implement this particular policy that there is a negative effect on the community in terms of crime, in terms of students being out of school. It's simply no evidence that that is one of the effects that has taken place as a result of implementing this policy.
All right, thank you. Let's see, there was another question I've got to scroll back to. Some schools are accepting religious exemptions for kids on some vaccines, but not on others. They want to be exempt on some. You know, what is the religious exemption policy? You know, how does that apply?
Yeah, thank you. The religious exemption policy is administered by DC Health. So there is a form that anyone who seeks a religious exemption can fill out. It allows the individual to identify kind of their particular circumstances. It is a decision that is left up to DC Health to determine if a person qualifies for religious exemption.
Okay. Let's make some closing statements. If you have some thoughts that you want to leave our audience with, I want to respect your time as well as our audience during their lunch hours or breaks. Closing thoughts. Who wants to go first? Dr. Mangat?
No, thank you all for attending. I really hope this was helpful. I think, I'm happy to chat afterwards about any of questions that may come up later. Again, your primary care provider, you can go to our website and view all the parent and caregiver and healthcare professional videos. Happy to chat about my personal vaccine decision for my children, but really hope this was helpful, and thank you for attending.
Thank you. And David?
Yeah, thank you, Keith. Well, thank you for this opportunity to share some information about the immunization attendance policy. Kind of a key takeaway, I hope, is the importance of making sure that students do have all the information on their immunization records available to the school. They're up to date, and that DC Health has done a wonderful job of making sure that there is access to vaccines at no cost to families if anyone still needs to get up to date and vaccinated.
Great. And Purvi?
I would just, we have a saying, a slogan, each one touch one. Please make sure that you ask your family and friends if they're covered. You'll be surprised to find folks who do not have health insurance coverage. And please send them to dchealthlink.com to see what they can do about that today and what kind of coverage is right for them. It's important to be able to access vaccines and every other type of preventive care that's important to your health and the healthcare coverage if and when you get sick. So thank you for having us here.
Great, thank you. Okay, I want to thank all of our presenters from DC Health, DC OSCE, the DC Health Benefit Exchange, as well as DC AAP. Thank you all for your time and taking time out of your schedules to help answer questions and hopefully clarify some of the questions or issues that are out there that people need more information on. There it is, the last slide is up. I want to put in a plug for our next town hall that will be focusing on mental health in the family. That is November 17th. And we'll be announcing more details of that one coming up. In the meantime, if you have any questions, you can feel free to reach out to us through the DC AAP website. It's actually aapdc.org. And we'll be happy to direct your questions or try to get your answers from our presenters or any of our internal resources. But thank you all for joining us, and we hope you have a good day.